Hello, everyone. Welcome to our health education program, It Takes a Village. Today, we are going to discuss how, as a community, we can support each other's health and well-being. Health isn't just about going to the doctor or taking medicine. It's about creating an environment where everyone, regardless of age, ability, gender, or background, feels safe, supported, and cared for. It truly takes a village to maintain a healthy and thriving community. Let's start by talking about one of the most valuable members of our community, our elders. As people age, they may face physical limitations or feel isolated. Based on findings from Mayo Clinic, there's an article about what you should know about caring for an aging parent. Discussing the changes that come with aging can be difficult for children and their elderly parents. The elders also love that they are guided and taken care as they need assistance in everyday lives. We can help by checking in on our elderly neighbors, offering to run errands, or simply spending time with them. Loneliness is a significant factor in declining health, but small acts of kindness can go a long way toward improving their quality of life. Additionally, we can help them access resources like home health care, senior centers, or community meal programs. Gun safety is another important issue when we talk about community health. It's vital to ensure that firearms are stored securely, especially if there are children in the home. Education on safe gun handling, proper storage, and advocating for safety in our communities helps prevent tragic accidents. Based on findings from CDC's Prevention Resources for Action, Suicide Prevention Resource for Action, and surveillance systems can help communities use the best available evidence to prevent violence and suicide. The resources emphasize the importance of a comprehensive approach to make communities healthier and safer. If you know someone struggling emotionally, be sure to check in, and if necessary, offer to help them find support. Sometimes ensuring safety is about having difficult conversations, but those conversations can save lives. Next, let's talk about injustice. We've all seen or heard stories about people facing unjust treatment, whether it's because of their race, gender, disability, or financial situation. As a community, we can stand up against these injustices by educating ourselves, speaking out when we see inequality, and advocating for those who don't have a voice. Whether it's supporting fair treatment in schools, healthcare, or workplaces, we can make a difference by showing solidarity and taking action. Let's also focus on how we can support people with disabilities. Many people with disabilities face daily challenges, whether it's accessing healthcare, education, or even public spaces. We can advocate for accessible facilities, ensure that individuals with disabilities have access to the care and support they need, and make efforts to be inclusive in our communities. It's important to listen to their voices, acknowledge their needs, and create a community where everyone can thrive, regardless of ability. Additionally, we can educate ourselves and others about the importance of disability rights and inclusion. Climate change may seem like a distant issue, but it directly affects our health. Rising temperatures, extreme weather, and pollution all have serious consequences for public health, from respiratory issues to food and water shortages. We can all do our part by reducing our carbon footprint, recycling, and advocating for policies that protect our environment. Protecting our planet is protecting our health and the health of future generations. Based on findings from CDC, climate change poses significant public health risks, including increased respiratory and cardiovascular diseases, injuries from extreme weather, and the spread of infectious diseases. It also impacts mental health due to environmental stress. Vulnerable groups, such as the elderly, low-income individuals, and certain geographic areas, are more at risk. The CDC's Climate and Health Program helps public health agencies prepare for these threats, promoting resilience and addressing the unequal effects of climate change on communities. One of the most powerful ways we can advocate for the health and well-being of our community is by voting. When we vote, we help shape the policies that affect healthcare, education, the environment, and justice. Registering to vote and making our voices heard ensures that we can create a future that reflects the values we care about, such as fairness, health, and safety for all. We all have a role to play in keeping our community safe, and that includes knowing how to act in emergencies. If you see a neighbor in distress, whether it's a health emergency or a dangerous situation, don't hesitate to call 911. Emergency services are there to help, and being proactive could save someone's life. It's also a good idea to learn basic first aid and CPR, so you can offer immediate assistance if needed. Some of our neighbors may have needs that go unseen, people with disabilities, mental health challenges, or those without stable housing. Advocacy starts with understanding and compassion. If you notice someone who needs help, guide them toward available resources or advocate on their behalf. Whether it's helping them find medical care, housing, or mental health support, knowing where to get help is crucial. Gender inequality affects everyone's health, whether it's unequal access to healthcare or disparities in the workplace. We need to support each other by acknowledging these challenges and standing up for gender justice. This means advocating for equal opportunities, equal pay, and access to healthcare that addresses the unique needs of all genders. No one in our community should go without food. Hunger can lead to serious health problems, and sometimes people struggle silently. If you know someone who is going through tough times, offer support when you can. Whether it's donating to local food banks, volunteering at meal programs, or sharing a meal with a neighbor, every effort counts. Let's ensure that no one goes to bed hungry. Lastly, managing our own biases is a critical part of creating a healthy and supportive community. We all have biases, but recognizing them and challenging them is key to fostering respect and equality. Whether it's being mindful of how we treat people from different backgrounds or questioning stereotypes, managing biases is about creating a more inclusive and empathetic environment. Today, we've discussed many ways we can support each other in health, from checking on our elderly neighbors to advocating for people with disabilities and standing up against injustice. Remember, health isn't just individual, it's collective. At Toto Health Equity Project and Minneapolis Health Clinic, we believe that by working together and looking out for one another, we can build a healthier, safer, and more supportive community. Thank you for being part of that village, and let's continue to care for one another.